Question 1. A 7-year-old child, referred to a social worker for behavioral issues at school, consistently struggles with making friends and often has outbursts when asked to share toys. During play therapy, the social worker observes the child avoiding eye contact and preferring solitary activities. Which of the following is the most important area for the social worker to assess first? A. The child's academic performance and learning abilities. B. The child's family history of behavioral health issues. C. The child's social-emotional development and peer interactions. D. The school's disciplinary policies and classroom management. Answer: C. The child's social-emotional development and peer interactions. This question tests your ability to prioritize assessment areas based on presenting problems, specifically within the context of human development. The keywords struggles with making friends, outbursts when asked to share, avoiding eye contact, and solitary activities all directly point to deficits in social and emotional functioning. Therefore, the most crucial initial step is to assess these specific developmental areas to understand the root cause of the behavioral issues. For example, understanding if the child has age-appropriate social skills or struggles with emotional regulation would directly inform intervention strategies. Here's an easy way to remember it: always connect the client's observed behaviors directly to the most relevant developmental domain for initial assessment. Question 2. A 15-year-old client reports feeling overwhelmed by school pressure, withdrawing from friends, and having difficulty sleeping. The social worker notes that the client appears fatigued and irritable. What is the best initial action for the social worker to take? A. Refer the client to a psychiatrist for medication management. B. Discuss potential coping strategies with the client. C. Contact the school counselor to reduce the client's academic workload. D. Explore the client's immediate safety and risk factors for self-harm. Answer: D. Explore the client's immediate safety and risk factors for self-harm. This question assesses the social worker's priority setting in a crisis-like situation, specifically focusing on client safety. The symptoms described, feeling overwhelmed, withdrawing, difficulty sleeping, fatigue, and irritability, can sometimes be indicators of increased distress that might lead to thoughts of self-harm, especially in adolescents. Therefore, the absolute first and best action is always to rule out any immediate danger to the client. For instance, directly asking about suicidal ideation or plans is essential before proceeding with other interventions. Remember, client safety is paramount, and it always takes precedence over other intervention strategies. Question 3. A 40-year-old client, recently laid off from a long-term job, expresses feelings of hopelessness, isolation, and anxiety about the future. The client lives alone and has limited social support. What is the next step the social worker should take after completing a thorough initial assessment? A. Encourage the client to apply for numerous jobs immediately. B. Connect the client with community resources for job placement and financial assistance. C. Focus on processing the client's grief and loss related to the job. D. Explore the client's personal strengths and past successes in overcoming challenges. Answer: D. Explore the client's personal strengths and past successes in overcoming challenges. This question emphasizes a strengths-based approach in social work practice following an initial assessment of a client facing a significant life transition. While connecting to resources and processing grief are important, exploring strengths helps build rapport and empower the client, which is a foundational step before implementing specific interventions. By highlighting their resilience and capabilities, the social worker can begin to foster hope and self-efficacy. For example, discussing how the client coped with previous setbacks can remind them of their inherent abilities. Always remember to begin by building on a client's strengths to empower them, rather than immediately focusing on deficits or external solutions. Question 4. A 3-year-old child is observed by a social worker during a home visit. The child primarily communicates through gestures, makes limited eye contact, and engages in repetitive behaviors. The parent expresses concern about the child's development. What is the most appropriate action for the social worker to take? A. Provide the parent with parenting tips for managing challenging behaviors. B. Recommend enrolling the child in a structured preschool program. C. Refer the child for a comprehensive developmental assessment. D. Advise the parent that children develop at their own pace. Answer: C. Refer the child for a comprehensive developmental assessment. This question tests the social worker's understanding of developmental milestones and the importance of early intervention for potential developmental delays. The observed behaviors, limited verbal communication, poor eye contact, and repetitive actions, are red flags that suggest a need for professional evaluation beyond typical developmental variations. Therefore, the most responsible action is to secure a thorough assessment to accurately identify any developmental disorders. For instance, an assessment could help determine if the child is on the autism spectrum or has other developmental delays, leading to appropriate early interventions. Always remember to prioritize professional assessment when developmental delays are suspected, as early intervention can significantly improve outcomes. Question 5. A social worker is conducting a first session with an 8-year-old child whose parents recently divorced. The child appears withdrawn and unwilling to speak. What is the best approach for the social worker to take to engage the child? A. Directly ask the child about their feelings regarding the divorce. B. Provide the child with psychoeducational materials about divorce. C. Offer the child age-appropriate play therapy tools and activities. D. Explain the confidentiality rules and the purpose of therapy. Answer: C. Offer the child age-appropriate play therapy tools and activities. This question highlights the most effective engagement strategy for young children in a therapeutic setting. Children often communicate their feelings and experiences through play rather than direct verbal expression, especially when dealing with difficult emotions like those stemming from a divorce. Providing play therapy tools allows the child to express themselves naturally and comfortably, building rapport without direct pressure to speak. For example, offering dolls or drawing supplies can help them externalize their inner world. Remember, with young children, play is often their language, so meet them where they are developmentally. Question 6. A social worker is working with an adolescent client who frequently posts concerning content on social media, including expressions of hopelessness and isolation. The client has not directly stated suicidal ideation, but friends have expressed worry. What is the first action the social worker should take? A. Discuss the client's social media use and its impact on their reputation. B. Educate the client about online safety and privacy settings. C. Conduct a thorough assessment of the client's suicide risk. D. Encourage the client to limit their time on social media. Answer: C. Conduct a thorough assessment of the client's suicide risk. This question emphasizes the paramount importance of assessing safety when there are indirect indicators of potential self-harm. Expressions of hopelessness and isolation on social media, even without direct suicidal statements, are significant red flags that necessitate an immediate and direct assessment of suicide risk. It is the social worker's ethical and professional duty to prioritize the client's well-being above all else. For instance, directly asking about suicidal thoughts, plans, and access to means is crucial before addressing other concerns like social media use or privacy. Always remember, when safety concerns arise, a direct risk assessment is the first and most critical step. Question 7. A 65-year-old client, recently diagnosed with early-stage Alzheimer's disease, expresses fear and frustration about memory loss. The client lives alone but has a supportive adult child who lives nearby. What is the most appropriate initial intervention for the social worker to provide? A. Help the client develop a detailed long-term care plan. B. Refer the client to a support group for individuals with early-stage Alzheimer's. C. Educate the client and family about the disease progression and available resources. D. Focus on encouraging the client to maintain independence as long as possible. Answer: C. Educate the client and family about the disease progression and available resources. This question addresses the initial response to a new diagnosis of a progressive illness, highlighting the importance of psychoeducation. When a client receives a difficult diagnosis like early-stage Alzheimer's, providing comprehensive information about the disease, what to expect, and where to find support is crucial for both the client and their family. This initial education empowers them with knowledge and helps them begin to adapt to the new reality. For example, explaining common symptoms, treatment options, and local memory care services can significantly reduce anxiety and empower informed decision-making. Always prioritize providing clear and comprehensive information to clients and their families when facing significant health changes. Question 8. A social worker receives a report that a 5-year-old child arrives at school frequently unkempt, hungry, and has visible bruises that the child attributes to falling. The parents are uncooperative with school staff. What is the first action the social worker must take? A. Schedule a meeting with the parents to discuss the child's well-being. B. Document all observations thoroughly in the child's case file. C. Make a report to Child Protective Services, CPS. D. Provide the family with resources for food assistance and hygiene products. Answer: C. Make a report to Child Protective Services, CPS. This question tests your understanding of mandated reporting responsibilities in social work. The combination of an unkempt and hungry child, unexplained bruises, and uncooperative parents are strong indicators of potential child neglect or abuse. As mandated reporters, social workers are legally and ethically obligated to report suspected child abuse or neglect immediately to Child Protective Services. For example, even if the bruises are from falling, the child's overall presentation of neglect warrants an investigation by the appropriate authorities. Remember, whenever there is reasonable suspicion of child abuse or neglect, reporting to CPS is always the absolute first priority. Question 9. A 20-year-old college student presents with symptoms of anxiety, including panic attacks, difficulty concentrating, and avoidance of social situations. The student expresses concern about failing classes and dropping out. What is the best initial focus for the social worker's intervention? A. Helping the student develop an academic plan to improve grades. B. Exploring the student's history of anxiety and potential triggers. C. Referring the student to a campus psychiatrist for medication evaluation. D. Teaching the student relaxation techniques to manage panic attacks. Answer: D. Teaching the student relaxation techniques to manage panic attacks. This question focuses on prioritizing immediate symptom management when a client is experiencing acute distress, specifically panic attacks. While exploring history and considering medication are important long-term steps, addressing the acute symptoms first provides immediate relief and helps the client feel more in control. Teaching practical relaxation techniques empowers the student to cope with immediate distress, which can then create space for deeper exploration. For instance, Diaphragmatic breathing or grounding techniques can help de-escalate a panic attack. Remember, when a client is experiencing acute and debilitating symptoms, providing tools for immediate relief is often the best initial intervention. Question 10. A social worker is working with an elderly client who lives independently but expresses increasing difficulty managing household chores and personal care due to arthritis. The client is reluctant to accept help, fearing a loss of independence. What is the most appropriate action for the social worker to take first? A. Arrange for a home health aide to assist with daily tasks. B. Discuss alternative living arrangements, such as assisted living. C. Explore the client's current support system and available informal help. D. Collaborate with the client to identify specific areas of difficulty and desired solutions. Answer: D. Collaborate with the client to identify specific areas of difficulty and desired solutions. This question highlights the social work principle of client self-determination and empowerment, especially when addressing concerns about declining independence. Before implementing any solutions, it is crucial to collaborate with the client to understand their specific needs and involve them in the problem-solving process. This respects their autonomy and ensures that interventions are tailored to their preferences. For example, asking the client to list the most challenging chores helps pinpoint where assistance would be most impactful while respecting their desire for independence. Always prioritize client collaboration and self-determination by involving them in identifying problems and solutions. Question 11. A 10-year-old child is referred for counseling due to aggressive behavior at home and school. During an initial session, the child reveals that their older sibling frequently bullies them. What is the most important area for the social worker to assess next? A. The child's relationship with their parents and other family members. B. The severity and frequency of the bullying, and its impact on the child. C. The child's academic performance and engagement in school activities. D. The sibling's behavior and potential reasons for the bullying. Answer: B. The severity and frequency of the bullying, and its impact on the child. This question focuses on assessing the immediate and most relevant contributing factor to the client's presenting problem. Once the child has disclosed bullying, it becomes the most critical piece of information directly impacting their aggressive behavior. Understanding the nature and impact of this specific stressor is essential before moving to broader family dynamics or individual traits. For instance, knowing how often the bullying occurs and how it makes the child feel will directly inform intervention strategies. Always prioritize assessing the most immediate and impactful causal factor for the presenting problem as revealed by the client. Question 12. A social worker is conducting an intake with a 30-year-old client who recently immigrated and is experiencing significant culture shock, difficulty finding employment, and feelings of isolation. The client expresses a desire to fit in but feels overwhelmed. What is the best initial intervention? A. Provide the client with a list of local job agencies. B. Connect the client with an immigrant support group or cultural community organization. C. Offer individual therapy to process feelings of isolation. D. Help the client enroll in English language classes. Answer: B. Connect the client with an immigrant support group or cultural community organization. This question addresses the unique challenges faced by immigrants experiencing culture shock and isolation, emphasizing the importance of community and cultural connection. While individual therapy, job agencies, and language classes are valuable, linking the client with others who share similar experiences directly addresses feelings of isolation and provides a crucial sense of belonging and practical support. This can help normalize their experience and provide a culturally sensitive pathway to adaptation. For example, a support group can offer shared coping strategies and a sense of community. Always prioritize connecting clients to culturally relevant community supports when addressing issues of immigration, isolation, and culture shock. Question 13. A social worker receives a referral for a 9-year-old child who has been diagnosed with ADHD and is struggling with impulse control and disruptive behaviors in the classroom. The parents report inconsistent application of behavioral strategies at home. What is the first step the social worker should take? A. Provide the child with individual therapy to improve self-regulation skills. B. Collaborate with the school to develop a behavior management plan. C. Assess the family dynamics and parenting styles within the home. D. Educate the parents on consistent behavioral management techniques. Answer: D. Educate the parents on consistent behavioral management techniques. This question highlights the importance of addressing parental consistency, especially when managing behavioral issues related to ADHD. Since the parents report inconsistent application of strategies, the most effective first step is to empower them with the knowledge and skills to implement consistent techniques, which is crucial for managing ADHD symptoms. Addressing the inconsistency directly can lead to a more stable environment for the child. For example, teaching parents about positive reinforcement and clear boundaries provides them with tools to create a more structured home environment. Always prioritize educating and empowering parents to implement consistent behavioral strategies, as their involvement is key to a child's progress. Question 14. A social worker is meeting with a 75-year-old client who has recently experienced the death of their spouse of 50 years. The client appears withdrawn, tearful, and reports difficulty eating and sleeping. What is the most appropriate initial response from the social worker? A. Assess the client for suicidal ideation and depression. B. Refer the client to a grief support group. C. Validate the client's feelings of loss and offer empathetic listening. D. Encourage the client to engage in social activities to combat isolation. Answer: C. Validate the client's feelings of loss and offer empathetic listening. This question emphasizes the foundational social work skill of active listening and validation, especially in the context of grief. When a client is experiencing acute grief, their primary need is often to feel heard, understood, and supported in their emotional pain. Providing a space for empathetic listening and validating their profound loss is the most appropriate initial response, building trust and rapport. For instance, statements like, "It sounds like you're experiencing immense pain right now, and that's completely understandable," can be very powerful. Remember, in moments of profound grief, simply being present and validating the client's experience is often the most important first step. Question 15. A social worker receives a call from a 16-year-old client who states, "I just can't take it anymore, I feel like giving up." The client then hangs up. What is the first action the social worker should take? A. Call the client back immediately to assess safety. B. Contact the client's emergency contact person. C. Alert the local police for a wellness check. D. Document the call and the client's statement. Answer: A. Call the client back immediately to assess safety. This question presents a clear safety crisis, requiring immediate action to assess the client's well-being. The statement, "I just can't take it anymore, I feel like giving up," is a direct indicator of potential self-harm. The most immediate and direct response is to attempt to re-establish contact with the client to assess their current safety and level of risk. For example, if the social worker cannot reach the client, then contacting emergency contacts or police would be the next step. Always prioritize direct contact with the client to assess immediate safety in a crisis situation. Question 16. A social worker is working with a 4-year-old child who frequently bites other children at daycare. The parents report no issues at home and are at a loss. What is the next step the social worker should take after gathering initial information from the parents? A. Conduct a behavioral observation of the child at daycare. B. Provide the parents with strategies for managing biting behavior. C. Explore the child's developmental history and family stressors. D. Refer the child for individual play therapy to address aggression. Answer. A. Conduct a behavioral observation of the child at daycare. This question emphasizes the importance of direct observation in understanding behavior that occurs in a specific setting. Since the biting behavior only occurs at daycare, observing the child in that environment is crucial to identify triggers, antecedents, and consequences of the behavior. Without this direct observation, interventions might be misinformed. For instance, observing the child might reveal that biting occurs during specific transitions or when interacting with particular peers. Always prioritize direct observation in the environment where the problematic behavior occurs to gain accurate data. Question 17. A social worker is facilitating a support group for single parents. During a session, one member begins to monopolize the conversation, consistently interrupting others and focusing only on their own issues, causing other members to become disengaged. What is the best way for the social worker to intervene? A. Allow the member to continue, as it's important for everyone to share. B. Directly confront the member about their disruptive behavior. C. Remind the group of the shared purpose and ground rules, gently redirecting the member. D. Ask the other group members to voice their concerns directly to the monopolizing member. Answer. C. Remind the group of the shared purpose and ground rules, gently redirecting the member. This question assesses the social worker's skill in group facilitation and managing challenging group dynamics while maintaining a supportive environment. The best approach is to gently, yet firmly, redirect the monopolizing member by reminding the entire group of the established norms and purpose, which encourages equitable participation without singling out or shaming an individual. This intervention protects the group's function and maintains a respectful tone. For example, saying, "Thank you for sharing, John. Let's make sure everyone has a chance to speak and reflect on our topic today," can be effective. Remember, as a group facilitator, maintaining balance and adherence to group norms through gentle redirection is key. Question 18. A 13-year-old client, who identifies as transgender, confides in a social worker about experiencing bullying at school and a lack of acceptance from family members. The client expresses feelings of sadness and anxiety, but has not shared these struggles with anyone else. What is the first ethical consideration for the social worker? A. Discussing the importance of family acceptance with the client. B. Exploring the client's feelings and experiences in a supportive environment. C. Immediately contacting the school to address the bullying. D. Assessing the client's immediate safety and risk for self-harm. Answer. D. Assessing the client's immediate safety and risk for self-harm. This question highlights the critical ethical duty of prioritizing client safety, especially for vulnerable populations facing significant stressors. When a client expresses deep emotional pain, sadness, and anxiety due to bullying and lack of acceptance, the first ethical consideration is always to assess for any immediate risk of self-harm or suicidal ideation. This ensures the client's physical and emotional safety before proceeding with other therapeutic interventions. For instance, direct questions about suicidal thoughts or plans are necessary. Remember, the principle of do no harm and ensuring client safety is always the paramount ethical consideration. Question 19. A social worker is conducting a biopsychosocial assessment with a 50-year-old client who has recently been diagnosed with major depressive disorder. The client reports a lack of energy, loss of interest in hobbies, and feelings of worthlessness for the past 3 months. What is the most important area to explore first when discussing treatment options? A. The client's past experiences with therapy and medication. B. The client's support system and social connections. C. The client's personal preferences and goals for treatment. D. The potential side effects of antidepressant medication. Answer: C. The client's personal preferences and goals for treatment. This question emphasizes client self-determination and empowerment in treatment planning. While all options are relevant, understanding the client's personal preferences and what they hope to achieve with treatment is paramount as the initial step in discussing options. This ensures that the treatment plan is client-centered and more likely to be adhered to. For example, asking "What are you hoping to get out of our work together?" helps tailor interventions to their specific needs and values. Always prioritize understanding the client's preferences and goals to ensure treatment aligns with their values and promotes their active engagement. Question 20. A social worker is preparing to meet with a 14-year-old client for the first time. The client has been referred for truancy and disruptive behavior at home. The parents have expressed frustration and a desire for the client to change. What is the best approach for the social worker to take during the initial engagement with the adolescent? A. Explain the consequences of truancy and disruptive behavior to the client. B. Advocate for the client's perspective to the parents before meeting the client. C. Build rapport with the client by listening to their concerns and experiences without judgment. D. Immediately set clear boundaries and expectations for their behavior. Answer: C. Build rapport with the client by listening to their concerns and experiences without judgment. This question highlights the critical importance of establishing rapport with an adolescent client, especially when they may feel resistant or forced into therapy. During initial engagement, the best approach is to create a safe, non-judgmental space where the client feels heard and understood. This foundation of trust is essential before addressing behaviors or setting expectations. For example, asking open-ended questions about their perspective on school or home life without immediately imposing solutions can help build this connection. Remember, building rapport and trust is the foundational step for effective work with adolescents. Question 21. A social worker is conducting a home visit with a single mother and her 6-month-old infant. The mother expresses significant fatigue and appears overwhelmed, stating she often feels isolated and has difficulty soothing the baby. The baby appears well cared for but cries frequently. What is the most appropriate immediate support for the social worker to offer the mother? A. Refer the mother for individual therapy to address postpartum depression. B. Provide psychoeducation on infant sleep patterns and soothing techniques. C. Connect the mother with local parent support groups or respite care options. D. Encourage the mother to spend more quality time bonding with the baby. Answer: C. Connect the mother with local parent support groups or respite care options. This question addresses the common challenges faced by new parents, emphasizing the need for practical social support and relief. While education and therapy might be beneficial, the mother's expressed feelings of isolation and being overwhelmed directly indicate a need for community connection and practical assistance like respite care. These resources can provide immediate relief and reduce feelings of isolation. For example, connecting her to a new mother's group could offer emotional support and shared experiences. Remember, for overwhelmed new parents, addressing isolation and providing practical support like connecting to community resources is often the most effective first step. Question 22. A social worker is working with a 60-year-old client who recently retired and now reports feeling a lack of purpose, increased anxiety, and mild depression. The client has good physical health and a stable financial situation. What is the best initial intervention to help the client adjust to retirement? A. Encourage the client to volunteer or pursue new hobbies. B. Refer the client for an evaluation for antidepressant medication. C. Explore the client's feelings about aging and mortality. D. Advise the client to reconnect with former colleagues. Answer: A. Encourage the client to volunteer or pursue new hobbies. This question focuses on proactive strategies for adjusting to significant life transitions, specifically retirement. When a client expresses a lack of purpose after retirement, the best initial intervention is to help them find new meaningful activities that provide engagement and a sense of contribution. This proactive approach addresses the void left by work and promotes positive adaptation. For example, suggesting local volunteer opportunities or adult education classes can help them discover new passions. Remember, for clients adjusting to retirement, facilitating engagement in new, purposeful activities is often the most effective way to foster well-being. Question 23. A social worker is conducting a family therapy session. The parents consistently interrupt their adolescent child, dismissing their feelings and opinions. The adolescent becomes quiet and withdrawn during these interactions. What is the most appropriate action for the social worker to take first in this situation? A. Confront the parents about their dismissive communication style. B. Ask the adolescent to express their feelings about being interrupted. C. Model respectful communication and set a boundary against interruptions. D. Explain the importance of active listening to the family. Answer: C. Model respectful communication and set a boundary against interruptions. This question assesses the social worker's role in managing communication patterns in family therapy. When parents are actively undermining the child's voice through interruptions, the most effective first step is for the social worker to model appropriate behavior and directly intervene to establish a clear boundary for respectful communication. This protects the adolescent's ability to participate and sets a precedent for healthier interaction within the session. For instance, the social worker might say, "Please allow your child to finish speaking. We want to hear everyone's perspective." Remember, in family therapy, the social worker often needs to actively structure communication to ensure all voices are heard and respected. Question 24. A 17-year-old client has recently been diagnosed with type 1 diabetes and is struggling with adherence to their medication regimen and diet restrictions. The client expresses resentment about the changes and feels their life is now on hold. What is the most important area for the social worker to address first? A. Providing detailed information about the long-term health consequences of non-adherence. B. Connecting the client with a peer support group for adolescents with chronic illness. C. Exploring the client's feelings and perceptions about the new diagnosis and its impact. D. Developing a reward system for the client to encourage adherence to the treatment plan. Answer: C. Exploring the client's feelings and perceptions about the new diagnosis and its impact. This question highlights the importance of addressing the emotional and psychological impact of a new chronic illness diagnosis, especially during adolescence. Before focusing on adherence or resources, it is crucial to first explore and validate the client's feelings of resentment, loss, and frustration. This helps the client process the emotional burden of the diagnosis, which is a necessary foundation for engaging with the treatment plan. For example, allowing them to express their anger or sadness can help them move towards acceptance. Remember, For new chronic diagnoses, addressing the client's emotional response and perceptions is a vital first step toward effective adjustment and management. Question 25. A social worker is working with a 2-year-old child whose parents are experiencing significant marital conflict. The child has recently regressed, frequently wetting the bed after being toilet trained and exhibiting increased separation anxiety. What is the best way for the social worker to help the child? A. Focus on behavioral interventions to stop the bedwetting and reduce anxiety. B. Provide individual play therapy for the child to address emotional distress. C. Advise the parents on strategies to resolve their marital conflict more constructively. D. Work with the parents to create a more stable and predictable environment for the child. Answer: D. Work with the parents to create a more stable and predictable environment for the child. This question emphasizes a systemic approach to addressing childhood regression and anxiety when family stressors are present. While direct therapy for the child might seem appealing, the most effective best intervention is to address the environmental factors contributing to the child's distress, namely, the parental marital conflict. By helping parents create a more stable and predictable home life, the social worker indirectly supports the child's emotional well-being and reduces the triggers for regression. For instance, encouraging parents to maintain a consistent routine and shield the child from arguments can provide a sense of security. Remember, for young children exhibiting stress-related behaviors, addressing the family environment and parental dynamics is often the most impactful intervention.